Hello and welcome to my channel. My name is Sean Navin. Glad you're here to join me today. I created this drug info channel to help provide useful information for you for any medications that you're taking, either prescribed or over the counter. I know a lot of times when you go to the pharmacy, there just isn't enough time to speak with the pharmacist or another staff member at the pharmacy to get the information that you need and feel comfortable with a new medication, this foreign substance, this chemical that is going to go into your body. There can be a lot of questions about how you're going to react, and I understand you just want to feel safe and comfortable. I know I do when I take any medication, so that's what I'm here to do. So if you're watching this video, you may have just been prescribed Eliquis, which is the brand name for a drug that is called Apixaban. So Eliquis and Apixaban, they're the same thing. I may use both of those names as I'm speaking, and so just know that they mean the same thing. So if your doctor just prescribed this for you, you may have some questions about how to take it, if it's safe. Maybe you were taking warfarin and now you're transitioning to Eliquis. And I know if you've been taking warfarin, you were checking your INR, your international normalized ratio, and you don't have to do that with Eliquis, so you may have some questions about that. So why listen to me? Well, I was a United States Public Health Service pharmacist for over 5 years. I helped a lot of patients manage their Apixaban and helped them monitor it and help them be safe with it. I helped a lot of people transition from warfarin to Eliquis. In fact, I was a huge proponent of this because I think the medication is safer, it's more convenient, and it's just as effective as warfarin. So to me, it's a win-win. We're going to talk about 6 main topics today with this medication that I think will help you feel really good about taking it. I'm going to talk about what it's prescribed for, how it works in your body. I'm going to talk about how you take Eliquis safely. We're going to touch on side effects and how to monitor the medication safely. We'll definitely touch on interactions, including drug interactions and food interactions. And by the way, hint, hint, there are no food interactions, so that's good. And then we'll end on how long you'll need to take Eliquis. So let's dive into it. So Eliquis is a really good alternative to the traditional anticoagulant warfarin. Eliquis came out in about 2011. It's part of a class of medications that we call direct oral anticoagulants, or DOACs. We'll say DOACs for shorthand. So in 2010, the first DOAC that came out was dabigatran or Pradaxa, you may know that name. And then shortly after, Eliquis came out as another option. So what is Eliquis used to treat? So there's 2 conditions that it's primarily prescribed for. The first condition is venous thromboembolism. That's a umbrella term for 2 conditions called deep vein thrombosis, or DVT, and pulmonary embolism, or PE. So those are the abbreviated versions of that. So DVT is when you get a clot in your leg. Pulmonary embolism is when you get a clot in your lungs. And we don't want any of those. The clot impedes blood flow, and that can be dangerous. The second condition that Eliquis can treat is atrial fibrillation. So that's when you have an irregular heartbeat. And when your heart has an irregular beat, that means blood can pool inside the heart because it's not getting pumped out efficiently. And when the blood pools in your heart, that allows a clot to form. And that's not good, because then once that clot is pumped out, because it'll eventually be pumped out, that clot can travel through your arteries and go into your brain and impede blood flow in your brain, which could lead to a stroke, which we definitely don't want to do. So Eliquis helps prevent clots in these 2 conditions. It can be used for other things, but these are the main ones that it's commonly prescribed for. So how does Eliquis prevent a clot from developing in the first place? So anytime a clot develops, it develops because there's some injury or lesion in your blood vessels, and your body actually wants to prevent blood from leaving the blood vessels. So it creates a clot or a plug using this what we call a coagulation cascade. So what is that? That just means that there's a bunch of proteins or factors in your blood that come together to create a plug anytime you get an injury in a blood vessel. So that creates the clot or the plug. So Eliquis, what it does, it actually binds to one of those key factors in the coagulation cascade and inhibits that factor, and that eventually leads to preventing the clot from developing. So that factor that it inhibits, it's called 10A. So if you wrote that out, that would be an X and an A. And you'll notice that Apixaban, which is the generic name for Eliquis, Apixaban has an XA in the name. And so that's how it's easy for the health professionals to remember that Apixaban is a 10A inhibitor. So Eliquis comes in a 2.5 milligram tablet and a 5 milligram tablet, and whatever dose you're taking, you'll take 1 tablet twice a day. It doesn't matter if you take this one with food or without. It does not affect the absorption or how it works in this situation. So if you're wondering, well, what dose am I going to take, or maybe you have your dose already, in general, most people start on 5 milligrams twice daily, and some people will take the 2.5 if we need to adjust it due to their age or their kidney function. Now, some people, if you're taking a higher strength tablet, we actually will prescribe it initially to help bust up a clot really quickly. In an acute situation, we'll prescribe, the higher dose for a short-term period just to dissolve the clot, and then we'll drop the dose lower for the rest of the treatment period. So when you start taking Eliquis, it starts working immediately. It gets in your system and is starting to work within 3 to 4 hours. So that's really good. It gets in there and does its thing pretty quickly, especially compared to warfarin. Warfarin takes much longer. So it gets in your body quickly, and then it also exits quickly, which is a good and a bad thing. So in this situation, when you're taking Eliquis, it's very important to be adherent or to take it as prescribed. You don't want to miss a dose. If you do miss a dose, you actually can put yourself at risk for developing a clot, because the medication does exit the body so quickly, then you don't have that protection anymore. So very important to take it every day. I understand we're not perfect, so if you miss a dose, don't worry, it happens, but you just really want to try your best to remember to take it every day. So what are the side effects of Eliquis? Well, if you look at the drug information packet that comes with the medication, it can look overwhelming, but the main thing you need to watch out for is, of course, bleeding. So what are the signs of bleeding that you want to watch out for? I always like to go through it in a systematic way, so this is easy for you to kind of help remember what you should look out for. So if we're starting from the head and go down to our stomach, signs of bleeding that you might want to watch out for in your head are a rapid onset of dizziness, slurred speech, or if you had a really bad headache, the worst headache you've ever had, that could be a sign of a bleed in your brain, which could be really dangerous. If you had bleeding going on in your nose, that's pretty obvious. You might have a nosebleed. If you brush your teeth and get bleeding in your gums, you might notice that. Again, this medication is making it easy for you to bleed because it's preventing clots. You might notice that. You want to watch out for bleeding that might occur in the stomach. Signs of that would be coughing up blood or seeing blood in the urine or stool. So if looking in the toilet, is there any blood when you go to the bathroom? Again, that could be a sign of a bleed developing in your stomach, and then you're seeing the results of that in the toilet. So one other thing you might watch out for is bruising. It's common to, if you bump yourself on a table at home or something, you could get a bruise. So that's another sign of bleeding. These things, most of the time they're not dangerous. So, if you get a bloody nose, for example, you might notice a little dribble of blood. But as long as it's just a small amount and it goes away pretty quickly, within a day, that's fine. You don't have to worry about it. But if it's starting to become more in volume and it's getting worse, then that would be a time to call your doctor and seek care. Now, if you felt like you're having a stroke, of course, that would be a time to go to the ER. If you notice blood in your urine or stool, again, I would definitely call your doctor and seek care that way. So how do we monitor Apixaban? So Apixaban does not require pricking the finger and measuring the international normalized ratio, or INR. Now, if you took warfarin, you definitely know what the INR is. At least I hope you do, because that's the way that we measure warfarin. And warfarin is super finicky, and due to its metabolism and just how it works and how the body processes it, it's important and necessary to check the INR. But with Apixaban, it does not require the INR. As long as you're taking Apixaban twice a day as prescribed, we know that it's working. It's been shown to work without looking at the INR or other blood tests. We know that it's working and that it's going to be safe. So the INR just won't be a useful test in this situation. And you don't have to worry, because this medication is super safe. It actually has been shown to have a lower bleed risk than warfarin. And if you do get a bleed, your chances of having a serious outcome like dying is much lower than warfarin. So put in other words, if somebody who's taking Eliquis has a bleed in their brain, an intracranial hemorrhage, versus somebody who's taking warfarin who's having a bleed in the brain, the person with Eliquis, who's taking Eliquis, has a much lower risk of dying from that bleed versus the person taking warfarin. This probably has to do with Eliquis getting out of your body much more quickly than warfarin. So before I mentioned it could be a bad thing if you miss a dose, but in this situation, if you get a bleed, it's actually good because it gets out of your body. It gives your blood a chance to normalize and help the bleeding go away. Whereas people with warfarin, if they have that bleed, it just takes a while for that to go away, and we have to use an antidote, which is vitamin K. All right, so let's talk about interactions now. So drug interactions are pretty minimal, but you do want to avoid NSAIDs. So that stands for non-steroidal anti-inflammatory drugs. So if you take these, they can increase your chances of having a bleed. So you want to avoid them. So these medications include ibuprofen, naproxen, and adult strength aspirin. The brand names for that would be for ibuprofen, that would be Motrin and Advil. Naproxen would be Aleve. If you're taking a baby aspirin, that's a little bit different, and it may be okay to take that with Eliquis, but you want to check with your doctor on that. When it comes to other medications, like prescription medications, the interactions are rare and minimal, so you don't really have to worry too much about that. If you have any questions about that, always talk with your doctor or pharmacist to make sure that you are being safe. When it comes to food interactions, I only bring this up because with warfarin, food interactions is a big deal because you got to watch the green leafy foods, but with Eliquis, you don't have to worry about that. You can eat all the green leafy foods that you want. In general, there's no food interactions. If somebody's saying that you should watch the grapefruit juice, technically yes, but in general, we don't really worry about that with this medication. So how long do you have to take this medication? Well, it depends on what condition you're using Eliquis for. So if you have venous thromboembolism, or you remember that includes a DVT or a PE, you're usually going to take the medication for 3 to 6 months, sometimes a little bit longer, sometimes 12 months. If you've had multiple clots in your leg and or lungs, that might mean you might have to take the medication for the rest of your life. But again, you want to be checking with your doctor about how long you need to take this medication. If you're taking it for atrial fibrillation, you want to, you're probably going to be taking the medication lifelong unless you're able to correct the rhythm with a procedure. And some people, their rhythm does get better over time. So then that might be a point to reassess if you need the medication. But if you have atrial fibrillation, you're going to need to take the medication as long as your rate is irregular. So just to summarize the main points with Eliquis, it's a medication you take twice a day. It's helping prevent clots in your leg, lungs, and if you have atrial fibrillation, it's a very safe drug. It's safer than warfarin if you're transitioning from warfarin. It's more convenient. You don't have to check your INR, and you don't have to worry about the food interactions. The drug interactions are much more minimal, again, compared to warfarin, but still watch out for NSAIDs, of course. Remember, it's important to take it every day. You don't want to miss a dose. Do your best to not miss one. But again, not everybody's perfect. Just take it as soon as you remember if it's pretty close to when you missed it. You'll likely be taking it for 3 to 6 months, sometimes longer, depending on your condition. That's all for now. I hope this video was really helpful for you. I know taking an unknown drug can be a little worrisome, a little scary, but if you have the right info and are prepared, you can be safe with it and everything will be good. So if you like this video, please give me a like, please give me a subscribe, so that you can get more drug info when it comes out. I hope you have a great day and I hope you are being healthy. So take care.